On this episode of Life's Little Miracles, Jessie's broken wrist and Benjamin's spinal cord surgery. Six-year-old Benjamin was born with Spina Bifida, leaving him paralyzed from the waist down.
Oh my God.
You're going to get your weight done, Ben. This means you're going to be put in the scale and see how heavy you are. Hold on tight.
Doctors suspect that scar tissue from previous operations has caused his spinal cord to become tethered or stuck to the surrounding muscles and bones. As a result, Benjamin is developing scoliosis, a severe curvature of the spine. Sitting in his wheelchair will become more difficult and painful.
Really hard, really hard, really hard, really hard.
Today, he will have surgery to free his spinal cord and try to keep his scoliosis from getting worse.
Okay, so I have to check you out from head all the way down to your toes. So I'm going to start off with your head, okay?
All the way down?
Okay, well, it's going to wrap this around your arm, and then I'm going to give your arm a hug. Can you hold your arm nice and straight for me? Here we go. Give your arm a hug. Thank you. So Ben, do you know why you're here? Can you tell me why you're here?
I'm here.
What's his usual temperament like? I did happy!
Yeah.
Where are we going?
We're going to visit the doctor first, Ben.
Okay, this is the waiting room right ahead here for your brothers. If you guys want to say goodbye to Ben and tell them you'll see him later.
Ben.
And then I'll take them over to the
Big hug.
surgical waiting room.
Fine. Where are you going?
I'm gonna go in there. Wait. Wait for you, okay? See you, okay? You're fun, okay? You good?
Okay.
Have a hug. Smooch. Okay, see ya.
See ya.
Yeah, hold your hand. I know.
13-year-old Jessie has been rushed to the hospital for emergency treatment.
No needles, right? Well,
He has injured his wrist in a snowboarding accident.
okay.
Hi there. You want to tell me what happened?
I broke my wrist. Snowboarding.
Yeah. How did you do that?
Landed on my wrist off a jump.
Okay, you know what? I need to see that. Just. That is painful. Can you move your fingers for me? Just a bit, all of them. Can I see your thumbs? Show me your thumb. Can you move your thumb?
Yes, it hurts
Good.
though.
Okay, so stop it. Don't move anymore. Okay. So first we'll do the pain thing.
Is that a needle?
It's a needle. On the other hand, the pain
This?
that you have, yes, the pain that you have in here is much, much worse than the needle you're gonna have. Okay?
What we're gonna do, you've already talked about starting the IV in your hand?
My hand.
Yeah.
Yeah, that's where it goes, Jessie.
Where
The
in my
vein.
hand?
In this one, not
This
that
hand.
hand.
You can't go into that
Too
hand.
bony.
Jessie,
No,
they'll
trust
find
me.
a vein.
What I'm gonna do, I'm gonna put like a tight band around your wrist, and it's gonna
They'll
make
find
your
a vein.
veins all fat, and I can see them, okay?
Is that needle gonna hurt?
It's gonna hurt a little bit, but you know what? It's not gonna hurt as much as your arm hurts right now. I just want you to take deep breaths, and I'm gonna count to 3, and I'm gonna tell you when I go in, okay?
Don't count to 3. Stick
You don't want me to count to 3? Ready?
Is it in yet?
Hold on, sweetie. You know what? It's all done. Still for me, okay? You're doing a great job. This is the medication. It's gonna go in now, and then I'm gonna hook it up to your.
It's gonna go in here, right? It's
Yeah.
not gonna hurt me.
Yeah.
Pain's gonna go right away.
Pretty quick.
I don't feel anything happening.
You will.
See Dr. Humphries soon?
When guys with this kind of problem of scoliosis and so on come back, we use what's called the top-down approach and start right at the top of the head and consider 5 different elements, the first of which is the shunt.
Right, okay.
And then move down through the Chiari and other components in the spine and finally get down to the real reason he's here, which is the tethering of the spinal cord. So we will focus on the back.
Okay.
Okay, champ? Nurses will be here shortly.
All right, okay, thank you.
Don't give the nurses too much cheek over there. I know you won't.
Are you ready to go, Ben? Okay. See ya. Yeah. Give mommy a kiss. There you okay.
See you later, Ben.
I got toy.
You're gonna put the mask over, you're gonna be going to sleep. Okay? Have to go, monkey. Come on.
Okay, sweetheart. Let's go.
Do you want me to come in? Are you sure?
Okay, boss is spoken.
Down we go. Good job.
Okay. Fingers.
We're gonna have to try to do is get your arm on its side. Okay? So do it the best way you can.
I can't do that.
You can't do that? For sure?
I think so.
You wanna give it a shot? If not, we can do it a
Okay,
different way.
it's fine. You have
I
to
mean,
keep
if you
going.
can't,
I'll
don't,
tell
I'm
you
not
when it
gonna
hurts.
force you.
Okay, don't move.
That's some pictures we're gonna take.
When am I gonna get my cast on?
I mean, I don't know.
Okay, can my mom has to know though, right?
No, your mom will find out when you do.
Is it bad?
I can't tell you.
What do I have? Did I tell you?
Jesse, morphine kicked in faster than what you think. I don't know what you have, Jess. A broken wrist.
Okay. He does your work.
What do I have?
Hi there.
You have
Let me show you. Okay.
Is it bad?
It's a fracture. See, Mom? There's definitely a fracture in here. You can see it over here too. Change in the shape of the bone. So what we need to do is to call our friends from orthopedics and ask them to reduce it.
So one bone just sort of shifted.
Well, it is one bone,
it is
but
one.
it's sometimes the reduction is takes time. Yeah.
So they're just gonna put it back into place.
Yeah. Sounds very
Easy,
fast
right?
and easy, but sometimes it's a bit more
So where will
complicated.
it-
So we're not drinking or eating anything right now.
Can I later on today?
Later on today, I'm quite sure you will.
You can see the difficulty when the scoliosis develops. Notice where the cord is running. I mean, it's arcing like a bowstring. That is the cardinal feature of the tethered cord in any circumstance. Okay, let's get going. Yeah, I would start about there. Yeah. Come down. Have to create a huge wound to find normal tissue to eventually come down on the target, which is in the abnormal region.
Now, the way that I would usually put the bone back in place, okay, is one by giving him some painkiller, okay, and a little bit of a sedative because it's not a very nice procedure, okay.
Does it work when you do it?
Does it work? I mean, does the bone get back in the right place? I would say probably 80-85% of the time on the first go at it, okay, that the alignment ends up being quite good. Now, Jess, first thing I'm going to need to do is to put some freezing in around the fracture,
Does it
okay?
hurt?
Putting the freezing in does hurt.
What? Is freezing gonna hurt more than it already is?
For a minute.
For how long? Like only a minute or more?
Actually, should only be about a minute.
Oh, I don't want a needle.
Jess, it's gonna take a second. It'll be really fast. Okay.
1, 2, 3.
You okay? Just give a poke.
Ow!
Okay. Little poke.
Hurry up.
Okay, now Jess,
All right.
that's a bit of freezing for the skin, all right? I'm going to need to put a bit more freezing in underneath that. You're going to feel a bit of pain here.
Ow! 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 Ow!
You'll start to see some blood there.
Okay.
The needle's out, Jess, and we're just going to, now we're going to let that freezing take effect. That should take within about 3 or 4 minutes. Okay?
So the ill-defined tissue right in the center, which has a slightly yellowish color there, is the spinal cord, and it's a little more distorted to the right than to the left. And coming up, and the adherence is right under here. So, if ever you need convincing that there is tethering, there you've got the flamboyant example of it, and it is rather severe. And give me Miller's Sin again, please.
There you go.
How much
Just sit
gas did you?
Okay.
Now after the cast is on, is it gonna hurt?
There will be some pain later, but we'll give you medicine for it. Slow breaths.
Like, can I eat after my cast is on?
Well, we're going to give you some medicine that's going to make you a bit sleepy. Once you start waking up, then you can eat.
I need to
Just think.
Do you want us to cut that off, or do you want us to take it off?
cut it off. It's getting too
Okay.
fast.
Okay. So your parents do the restaurant thing. Your parents make you work in the restaurant?
No, they don't make me.
They don't make you? Oh, that's what they say. So it's not like a child labor kind of thing.
No, I get paid.
All right. So Jess, in just a minute, I'm going to try and move your fracture, put it back in place, okay?
It's gonna hurt.
It might hurt a little bit, but most of the pain should be dealt with all the medicines we've given you. Okay, Jess, I'm going to count to 3. So 1.
Wait, it's gonna hurt a lot.
We're giving you a lot of medicine, so it shouldn't hurt more. I'm pushing on it pretty hard there right now, and it doesn't seem to be bothering you as much as it did before. So you will feel a pull, okay? But I need you to hold your arm still. So 1, 2,
And blow. Blow it in. Blow it in. That's it. Big breath and blow. Slow it down. Slow it down.
That's it. It's okay.
Slow your breath. Okay. Slow it down.
Let me hold down my leg so I don't kick somebody.
Okay, see, it's really bad form to kick the dog here, okay? So I'm just going to pull a little bit here, Jess.
Down.
Slow it down.
Not too far. Not too far.
There's the click.
In.
Take it easy.
Let's put a cast on and check the alignment, okay?
Slow it down. Good boy. That's it.
Slow it down, Jess.
Long and slow. Long and slow. Big breath and blow.
That looks pretty good. So it's now time to close the sleeve again, the dura, around the cord. So we have been able to dissect around the portions of the original spinal cord and free it up so that previously it was arced like a bowstring right up against the back of the spinal canal, and now it's down in where it should.
Is there any chance of reoccurrence with a tethered cord still then? Or?
Sure there is.
Is there?
Sure there
Okay.
is.
Okay.
Having done it once, the chance of it happening again are 20 to 30%.
Hi. How are you guys? There, this guy's waving. How are you? Are you okay?
Hi.
He's good.
Yeah, it's
Oh, I'm sorry?
Is that normal for him to
Well,
be
he's a
so
little
bad?
warm, so I guess they kept him nice and warm in the operating room, which normally they come in very cold.
Oh, right here. Mommy's right here, honey. I'm surprised he's on his back right away. Is that normal?
Mm-hmm.
Okay.
We do back, side to side rolling, like log
Okay,
rolling, just to keep
okay.
his spine straight.
Okay.
Yeah, what we have to do is shape the cast a little bit.
Wow.
Hurt a bit?
We're going to send him for another x-ray. Okay, check the position of the bone. I mean, there's a possibility the alignment may not be exactly as the way we want it. The x-ray is the only thing that will actually show us that. So we may have to go through part of this again, but
Okay.
take it one step at a time, okay?
Hopefully it'll be fine.
But they're in here.
Morning, guys. How are you doing? Are you having any discomfort in your back? No. Okay. Do you mind if we just roll you over to take a look at your back for a second?
Are you awake? Are you awake for that to register? Huh? You got
Sorry.
a thumbs up. You missed it.
Yeah. Oh, that. Okay. Okay. That looks great.
The one thing I was just wondering with going back to school, I was figuring like after March break, and I guess just pretty well as tolerated, or
Yeah, pretty much is tolerated. I mean, he's gonna get tired when he's sitting up for long periods of time from the operation. Kid'll get sore in the back. You could probably start part-time and see how he does, and then work up from there. He'll tell you.
okay,
You'll know. You know, he knows best, and you know best. So, okay.
okay.
Okay, Benjamin. Take care.
Are you waking up, Mr. Jess?
Yeah, is
Oh,
my arm
cool.
better?
Is your arm? It looks better. All right, so Jess, just for your own edification and interest here, here's the before. See how that piece of the bone is sitting out on the side here? See how now it's all in the right place?
Do you see it?
Okay? I have some instructions to go over with you and your mother. The most important things are one, that it stays clean and dry, okay? Nobody can sign it tomorrow, but after that people can sign it, okay? Your mother is the first person who's allowed to sign it. Got it? Okay. If you want to have something right now, drink some water.
Can I drink some iced tea instead?
No water. Oh my god.
Oh, but water's just plain and boring.
Apple juice, that's all we got.
Perfect. You got already. Should have given you 5.
So how are you feeling in your chair?
Fine.
Yeah, is your back okay?
Yeah.
Yeah. Okay. Now you're gonna show me these big muscles here. And pull up. Pull, 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 pull. Oh, you're working hard, eh?
Yeah.
Yeah. Now, so are you able to push yourself in the chair?
Yeah.
Can you show me how? That's it. So you need to just increase his tolerance sitting up in the chair again so that he, once he gets back home, then he can tolerate sitting up in the chair for the full day again.
All right.
The main thing is we want to just make sure that he was able to get up into his chair and he was comfortable.
Come on, I'll help wash the Cheerio down. Come on. Come on, drink. Let's go. Good morning.
I haven't had breakfast yet. Are you going to share or what's going to happen
Probably
here?
will.
How are you feeling today?
Use your words. How you feeling?
Can you bend forward for me so I can see what's cooking? I want this wound to be good and solid.
Okay.
The little plastic coating here will flake off, and I talked to you at the end of the week about coming back for the sutures to be out. Okay?
Okay, give
You're
him a high five.
Thank you.
Okay.
Okay?
I think we might take the cast off today and see whether it feels like it's healed or not. The x-ray shows that everything is in a good position. The break was down in this area and there's some signs of new healing bone there. So this is in an area that the bone grows.
Yeah.
And the chances of there being a disturbance of growth is pretty tiny, but that'll require further x-rays in the future, even if it is healed.
Hi Jessie, how you doing? Good. Come on right in here.
Now the saw makes a lot of noise and wiggles and jiggles and shakes, but it doesn't hurt you. Okay? I'll get you to cover your ears up. Now gently, gently, gently. I'll give you a clean piece of towel. That's weird. Now please don't scratch it. You don't want to make it bleed. No, it just looks weird.
How's it feel down here?
Can't feel any pain.
It hurt you? No. I think it's okay to leave him out of the cast because I think it looks like it's healed. You're not ready to go back to sports yet. And the reason I know that I can trust you, because if you go back to sports and fall, it would break in the same spot. And then you would be back in a cast again. And you don't want that, do you?
Hey, what's that? Doesn't matter. I don't care how I look.
Here, because you cut it through.
Jesse's wrist is now strong enough for him to help in his family's restaurant.
Curl up your fingers. That's it.
Doctors will follow Jesse to ensure his wrist bone continues to grow, but they are optimistic that Jesse's wrist will completely heal and that he will be snowboarding again next winter.
Garnish it with bird seed.
Yeah.
Get that thing.
Are you excited or something? Yeah. Yeah, get those stitches out.
So where does he stuck
The top.
So maybe what we'll do is we'll start at the bottom to get rid of those ones so that in case it...
Rid of
I can get rid of them? Okay.
Okay, hold still. Stay still another minute, okay?
Can I cuddle?
Yeah, you can still cuddle me. You're doing great.
We'll just get Dr. Humphries to come back and have a peek at the bottom part.
When we get to what's called the second age of spina bifida, scoliosis is one of the manifestations of the scarring. The longer-term question is, will it correct somewhat now that the tension has been taken off the spinal cord down here? It's a waiting game to see what's going to transpire with respect to the curve.
Did you get all that in okay? There will be no exam on this. You'll be happy to know.
Oh, I'm glad about that too.
And me too.
Gonna drive on the roads? Oh no! Oh no! Oh, you almost fell off. Oh.
Go.
Okay, we're going. And boom!
Benjamin has now fully recovered from his surgery. Doctors hope that freeing up his spinal cord will keep Benjamin's scoliosis from getting worse, and that he will be able to continue to enjoy activities like playing in his wheelchair without pain. On the next episode of Life's Little Miracles, John's kidney transplant.